Hi, I'm Queen Johnson, and you're watching Spotlight. Today I'm at Lagniappe Medical Clinics, and I'm with Charlie Barnett, LPC, Licensed Professional Counselor. Hi Charlie, how are you today?
I'm doing great, Queen. How are you?
Good, good. Let me start by asking you, what is behavioral health?
Behavioral health encompasses a wide variety of mental health challenges that many people struggle with. Diagnoses such as depression and anxiety, all the way to more complicated diagnoses such as bipolar disorder or even schizophrenia. We also have the opportunity to work with patients that have experienced trauma or even grief. A lot of our patients have post-traumatic stress disorder or even ADHD. And so we have the opportunity to work with all those types of mental health concerns here in our behavioral health department.
Okay, and so is this service provided at all of your locations?
Right now we have our behavioral health teams strategically kind of located in two of our most central locations. We have a location at Polo Road, and then we have a team there with both board-certified licensed professional counselors, and then we have a nurse practitioner at our Polo Road facility that just does med management for our behavioral health team there. And then we also have another full-time therapist and a physician's assistant at our West Columbia office. So we're able to service the two most central areas where all of our patients live in the greater Columbia area.
Okay, and what if a patient has a preference to having a male or female counselor? Is that a possibility for them?
It certainly is. So we have a male counselor at our Polo Road location, that would be me, and then we also have a female licensed professional counselor at our West Columbia office.
Okay.
So they do have a choice.
Okay, and is this a service that has to come as a referral?
Not necessarily, no. If we do have folks that come from outside of the Lagniappe family, we do like to manage both their medications if there's a medication need and their counseling at whatever location that they choose to come. But it does not require referral at this time.
Okay. And what about insurance? Does that cover it?
Certainly it depends on the plan, but in most cases insurance companies do cover behavioral health services. Sometimes there's a limited number of sessions that they will allow. But we even service Medicaid and Medicare patients as well. So in general, most insurance companies do cover the behavioral health services.
Okay, and you mentioned medication earlier. So let's say someone is on meds. Is the medication monitored by a counselor or by an associate here at the clinic? Actually
both. Any of our clinical staff are able to monitor the patient's medications. And so if they come in to see their primary care physician or if they come in to see another clinical staff, they are monitored for that. But in general, the counselor does monitor the medications because they're seen more frequently by the counselor. And then we communicate that to the staff because we have an integrated model that allows us to be able to collaborate with the actual providers that are prescribing the medications and that kind of thing. It also allows for a lot of flexibility if they have any side effects or if they're having any problems with their medications for us to be able to take care of those needs as quickly as possible.
Okay, and just let me ask real quick, what's your website address if someone wants to reach out?
It's www.lagniappemedicalclinics.com.
Sounds good. Good being with you, Charlie. Thank you.
Thanks for having me.
Folks, thanks so much for watching. We'll see you again soon on another edition of Spotlight.